Hello everyone, Happy New Year. It's Dr. Bowen, a board certified physiatrist here at New Jersey Regenerative Institute, or NJRI. I work alongside Dr. Thomas Agason to provide non-surgical solutions to orthopedic problems. Our goal is to help you unlock your intrinsic ability to heal. Today, we're kicking off a new series on shoulder pain. Since our 8 most common knee problems video was so successful, I thought I'd do the same for the shoulder. So today we're diving into the 6 most common shoulder issues we see here and treat at New Jersey Regenerative Institute. If you've ever dealt with any shoulder pain or discomfort, limited mobility, or just curious about shoulder health, this video is for you. Make sure you subscribe, hit that notification and bell button so you don't miss any of our videos or any of the information coming up. We'll discuss 6 shoulder issues, their symptoms, causes, and the best treatment options. So let's get started. First, let's tackle impaired posture and scapular dysrhythmia, which often lead to impingement. Impaired posture refers to abnormal alignment of the head, neck, shoulders, and upper back, which can affect how the shoulder joint functions. This includes forward head posture and rounded shoulders, 2 very common issues, especially with people using laptops, computers, and cell phones with bad ergonomics. Scapular dysrhythmia refers to abnormal or uncoordinated movements of the scapular shoulder blade during shoulder motion. The scapula sits on the back side of the rib cage and connects the humerus or upper arm to the clavicle or collarbone. Impaired posture and scapular dysrhythmia are closely connected. Poor posture, especially when sustained over time, can weaken or tighten muscles around the scapula. This imbalance disrupts normal scapular movement patterns, leading to dysfunction and eventually shoulder pain. They both usually lead to impingement or pinching of structures mainly in the rotator cuff tendons. Impingement isn't a true diagnosis. It's a mechanical abnormality that results from poor posture or impaired movements during activities that causes the shoulder blade or scapula that sits improperly to move inefficiently. The result? Well, structures like the rotator cuff and bursa can get compressed, leading to pain and limited movement. Posture and scapular movement are essential for shoulder mechanics. Here at NJRI, we focus on physical therapy and exercises tailored to restore scapular rhythm, address postural deficits, and optimize the biomechanics, often as our first-line recommendation, or at least in combination if additional issues are present. Sometimes patients can't participate adequately in physical therapy because they have too much pain and they need some type of intervention first. So to demonstrate abnormal impingement because of bad mechanics, if you look at some people's posture when they sit, their head's forward, their shoulders are rounded, and as you try to move the shoulder, it gets hung up, impairs, and impinges. But if you sit up nice and straight, get your head back, you can see how much more freely your shoulder can move, minimizing or limiting the amount of impingement or shoulder dysfunction you're going to have. Next is Biceps Tenosynovitis, which can progress to what's often misdiagnosed as a Popeye muscle when it tears. This condition occurs when the long head of the biceps tendon in the front of the shoulder becomes inflamed or even ruptures at the shoulder, causing a bulge in the biceps. While it looks dramatic, it's typically a mechanical and aesthetic issue rather than a severe injury. Treatment ranges from physical therapy to, in rare cases, surgical intervention. If you're old enough to remember Popeye, he had large forearms, not a bulge in his biceps, which is why it's a misnomer. Moving on, shoulder separations or AC joint sprains happen when the acromioclavicular ligament is injured, often from a fall or impact during sports. The shoulder is not actually separated from the body. Symptoms include pain over the top of the shoulder and difficulty lifting the arm. Sometimes there's swelling on top of the shoulder. There are 6 grades of AC joint sprains, ranging from a mild sprain where the ligament is stretched but not torn all the way, to severe injuries with significant displacement or damage to the surrounding muscles, requiring surgical intervention. One usually will see the end of the collarbone or clavicle sticking up in the most severe cases. Rotator cuff tendinopathy is a spectrum of disorders from tendinitis to tendinosis and is a leading reason for shoulder pain. Bursitis can often accompany it as inflammation spreads to the bursa. However, true bursitis in a person without an underlying rheumatologic condition is fairly uncommon. The issue is usually with the rotator cuff tendons. Tendinopathy just means bad tendon, and there are subcategories from tendinitis to tendinosis. A tendinitis is also uncommon in people without a rheumatologic issue. Tendinitis means inflammation of the tendon, and this can occur after initial trauma, but generally after 1 to 2 weeks, it is resolved. If there are current and continuous symptoms, then most of these issues would be a tendinosis, which means tendon degeneration. These tendon terms are one of the main reasons that I'm in this area of medicine today. In my residency, I read information by Dr. Nerschel, who discussed tennis elbow, noting a lack of inflammatory cells present and that tendinitis is actually a misnomer. This got me curious about what was happening at a cellular level and why we were using steroids or cortisone, which would be inconsistent and cause more degeneration. The good news is in most cases, conservative treatment like physical therapy to correct biomechanics by restoring scapular rhythm, motion, and improving balance strength can be successful. Non-steroidal anti-inflammatory medications like Advil, Motrin, or Aleve are often used for pain, but they're not just analgesics, and they can impair recovery as they can inhibit inflammation, the good kind, which if modulated appropriately, direct the repair and recovery. At NJRI, we can also take advantage of regenerative treatment options for resistant cases. People usually respond to platelet-rich plasma or PRP for bursitis around the tendon or into the tendon or tendon structures for tendinosis. Shockwave can also be an option, especially if someone is averse to needles. Some people may have calcium deposits in the tendons called calcific tendinosis, and this can be addressed with percutaneous tenotomy or shockwave. A percutaneous tenotomy uses a needle or a device such as Tenex or Ocelot to break up the calcium and allow healing. Rotator cuff tears are surprisingly common and don't always cause symptoms. While many believe surgery is inevitable, that's not true for most cases. Just think about a study published in 2014. Asymptomatic rotator cuff means tears without complaints were present nearly 10% of the time in 20-year-olds and increased in frequency with each decade to just over 60% by the time people reach their 80s. There are two main tears, partial tears and full thickness tears. We focus on non-surgical treatments tailored to restore function and to reduce pain, emphasizing physical therapy and patient education. If this more conservative approach does not resolve one's symptoms, I would generally consider a cellular procedure such as MFAT, which stands for microfractured adipose tissue. This acts as an intrinsic scaffold to fill in that gap or tear. Since we have followed patients' responses, PRP does not usually provide an adequate response for a tear. Lastly, shoulder arthritis involving the glenohumeral or acromioclavicular joints is a degenerative condition with thinning or loss of cartilage and a change in the bony structure causing pain, stiffness, and reduced mobility. Our approach combines physical therapy, lifestyle modifications, supplements, and regenerative treatments to manage symptoms and improve function, because the usual option is a total shoulder replacement. And this is a big surgery that takes approximately 4 to 6 months or more for full recovery. The regenerative treatments that include MFAT, microfractured adipose tissue, BMAC, bone marrow aspirate concentrate, or your own stem cells, which are often combined with other treatments. And there you have it, the 6 most common shoulder issues explained. Remember, early diagnosis and treatment are critical for maintaining shoulder health. Be sure to subscribe to our channel so you can follow along over the next 6 weeks as I go more in depth on each of these topics. If you're struggling with shoulder pain or dysfunction, we'd love to help you. Give the office a call and set up an appointment with either myself or Dr. Agason here in Parsippany, New Jersey. Finally, remember, please like, subscribe, and neither of those cost you anything and help us out a lot. Hit that bell notification for more health tips and make sure you don't miss anything. Follow us online or follow us on TikTok, Instagram, Facebook, or X. Links are all in the description and pinned in the comments below. Thanks for watching and great health in the new year.